I would say it depends on the severity of their problems. So somebody that has an actual large stone that we need to extract, it's a more involved procedure to take it out, as one would expect. And because of that, it can be a little sore. So I'm always happy to provide patients whatever they need for pain control ultimately, but the majority of patients don't need anything more than Tylenol for pain, even the day of surgery, so after when they're recovering. And ultimately, you know, I like to compare it, or what patients tell me it kind of compares to is like if you bit your tongue.
Oh.
You know, that kind of pain. It's kind of, maybe it's a little sore in your mouth, you know, in the bottom where we did the procedure. It's a little sore there, but over a period of 1 or 2 days, it's not really noticeable at all. It's a procedure to look, and you're diagnosing at the same time, just like you would with a CAT scan, or we used to do these things called sialograms, which were, you know, kind of like a fluoroscopy kind of procedure to look at the salivary gland, which we really don't do much of anymore, but you're actually diagnosing just like you would when you're doing a colonoscopy. You're diagnosing, and then you're opening things up at the same time, or removing the stone or the offending problem. So you're actually looking at the area where the problem is, which is the duct in most cases, and then diagnosing the problem and then treating the problem at the exact same time, versus you do your diagnosis, you've got your imaging, and then you have to do a second procedure to treat the problem. You're doing it all at one sitting as well, which is nice for patients. It's more expedient from that manner as well.